Hi, Senator Coburn. My name is Marla Linscomb.
Nice to meet you, Mom.
Nice to meet you too. I just wanted to take a few minutes of your time.
Have a seat.
Thank you so very much. How are you doing this afternoon?
Great.
I wanted to discuss with you to see if I could get your support in the H.R. 2187 bill. Are you familiar with that?
A little, but you might have to remind me.
Okay. Well, as a physician, I'm sure you're aware of how very important it is for nurse-to-patient ratios. One of the things that, if this bill is to pass, the requirements would be for the hospitals to implement a staffing plan, and what the staffing plan will do will actually be set up to show or give them minimum nurse-to-patient ratios. And it will also require health services to develop a national acuity tool, which then the hospitals will implement for nurses, so the charge nurses will be able to come in and adjust their staffing based on the type of acuity patient. So for instance, as an example, in an ICU, the ratios would be a 1-to-2 ratio. However, if you've got a patient that's critically ill, then you could put that patient as a 1-to-1 ratio.
Okay.
And experts have actually said that in 2020, there will be a shortage of 350,000 nurses. With one of the other points, I don't know if you're familiar with Joint Commission, but they're one of the...
Yes.
Great. Well, as you all know, we have to meet those standards, and Joint Commission has actually given reports that have shown that with all of the medical errors that have been reported to them, 25% of those medical errors were contributed to inadequate nursing staff. And the American Nurses Association has said that for each additional nurse employed annually, over $60,000 annually can be reduced in medical costs by decreasing the length of stay and patient mortality.
That's interesting.
I think that's a very good savings. So did you know, I was doing some research on Oklahoma, and I didn't notice that Oklahoma had any representation or any parts as far as ruling towards staffing ratios. I did notice that there's 15 states so far that's been involved in passing legislation or regulations towards staff. So I'm actually coming to you asking to see if you would help support us in this H.R. 2187 bill to help staff. I think it's very crucial for nurses to be able to help with their nurse retention and nurse recruitment, and also help with patient outcomes.
Right, look at it and see if we can.
Great, thank you so very much.
Sure.
Well, I really do appreciate your time, and I'm going to leave you with this little brief here that has some more information on it.
Okay.
It has my contact number on there, so if there's anything I can do to help be involved or anything I can help in the future, please don't hesitate to give me a call.
We will do. It's
Okay.
a pleasure to meet you.
Thank you. It was nice meeting you
Thank
too.
you, Mark.